My name is Ruth Schumacher, and I am an assistant professor in the Department of Nursing and Health Sciences. One of the courses I teach is family health nursing, specifically pediatrics. It's a very dense and jam-packed course. Students prior to this course have packed their suitcase with knowledge of the sciences, psychology, and a year's worth of nursing courses. At this point, they need to unpack that suitcase of all their previous knowledge and apply it to working with children. The lightning round is a series of questions in a PowerPoint similar to a Kahoot. There were some limitations to Kahoot, such as a limit on the number of characters you can use, and you have to pay for the upgrade to use multiple response questions. Also, I couldn't leave rationale for the questions and responses. For those reasons, it is why I chose to use a PowerPoint. I developed approximately 40 questions to be utilized in 20 minutes. A side note, their exams were 50 questions each. These questions were based on course or weekly outcomes and course concepts such as communication, critical thinking, and decision making. Students in the course had to use their previous and current knowledge to answer these questions. The goals and outcomes of the lightning round. It was to provide a fun way for learners to review information prior to an exam and to identify their areas of competency and those that still need further review. The lightning round appeals to all learners as it has visual, audio, and kinesthetic components. It actively engages a student in the room through some movement. It also got their adrenaline going, especially if they wanted to avoid having to answer a question. What I had hoped was students would sail through the questions in the short amount of time allotted. What I found, it was too many questions for a short time frame. I was using teach out as needed to explain the muddy areas, which added some extra time. Since I spent the time developing the questions and students wanted to review them again, the questions were very similar to what they would see on the exam. I posted the PowerPoint and included the correct, incorrect responses and rationale. The PowerPoint was posted after the review sessions were completed. The rules were simple. Catch the football, answer the question and give the rationale, and then throw the football to the next person. However, if you couldn't state the rationale or couldn't answer the question, you could ask a friend or a foe to assist you. I would always ask if everyone understood the response, because invariably the person answering the question may know the response to that question, however, others in the room may not. And if there was someone who said, I did not, then I would do a brief teach out either by asking the student, another student, or myself. Only one question per student was allowed once they received the football. They could help as many times as asked. Math questions were a little more difficult as I had the entire room complete the problem before an answer was given. These math problems should be second nature as they had an entire module the very first week of school and were doing these problems within the clinical setting. However, there was still an element of math phobia. I would suggest leaving those off going forward. Drawbacks to the game. After the first few times of throwing the football, students would start looking down in the not me pose. Some students also had a tendency to shout out the answer when it was not their turn. In the next couple of slides, there are some examples of questions that I had asked. This is an example of a dreaded math question. It's a fairly easy equation for students to complete. However, sometimes anything with math or anything with numbers can make them anxious. I didn't want to put anyone on the spot, so as I mentioned previously, I will definitely remove these going forward. In this case, the safe dose range is 10 milligrams to 15 milligrams per kilogram per dose. All the student needed to do was multiply the weight of 10 kilograms by the 10 and the 15. And if you're wondering what the correct answer is, well, it's 150 milligrams because 10 times 15 equals 150. This is a knowledge question and something they have learned in pharmacology during their first and second semesters of the program and in obstetrics, which they are taking concurrently with pediatrics. The correct answer in this case is D. None of the other options contain vitamin C. Administering on an empty stomach with a vitamin C beverage aids in more rapid and thorough absorption. Finally, the next slide will show an example of a higher level question. A nurse is caring for a preschool child experiencing a sickle cell vaso-occlusive crisis. Which orders should the nurse question? This was a select all that applies, so it was more than one response required. For this question, students had to have knowledge of pathophysiology, growth and development, and treatments to decrease pain for a child with a vaso-occlusive crisis. This was more knowledge and application. It required some critical thinking and decision making. Of course, in the notes section, I provided the rationale for both the correct and the incorrect responses. In case you're wondering, the correct responses are B, D, and E, and the incorrect are A and C. The lightning round is easy to develop. No cost, unlimited characters can be used. It allows students to identify what they already are comfortable with and to identify what they need to spend more time on studying. Limitations are their avoidance of answering questions for fear of being incorrect, and math because it may take them longer or make them anxious. It was enjoyed by many students as the course evaluations listed positive comments for the activity. I would still use Kahoots during a class session as they are fun and engaging, but specifically identifying something different, such as a lightning round, can expand the idea of a Kahoot to be an excellent way to review course content. If you have any questions, feel free to contact me.